Sugar, you're the best.
The heck?
DeGeorge.
Where do you want me?
Grab your folder and you can come over
Want
here.
to sit over here? This is Dave DeGeorge. Typically, you know, everybody was notified of this, and Dave DeGeorge, we try to call, you know, people to remind them the day of. This has been a wacky, you know, time. Mary Angeli did try to call his home, and it rang with no answer, and there was no voicemail to be left. So, you know,
Oh, what about my phone? We could've, Vicky or something.
I don't have Vicky's, you know, nobody's ever given me that info.
This is so weird.
It is.
It's kinda weird.
So socially distanced.
There's a school board meeting tonight,
Oh, you do have one tonight?
so that'll be from home.
Zooming it?
No, we're Google Meets.
Oh, when Zoom started having problems, you guys moved to Google Meets. I think Zoom has rectified their problems, yes.
Yeah, we are streaming, but give them a little bit.
See, I don't,
Here, I'll take this around.
And are we unable to meet, we had talked about that at the last meeting, like using Zoom or Google Meet, we're unable to do that?
this was the most
have one of those.
efficient way to do it. So we just didn't have the lead time. Zoom would have been, I don't know, difficult, I think. So we just felt like this was the next best option. We met with Mike Franklin and,
For someone at home,
oh,
No,
for someone at the office.
it's me. Those are cute. Who did those, Chris?
Stacy Stevenson, she's gonna open up a bakery.
Thank you.
Yeah.
Those are cute.
I have to have the mask. I can't, thank you, Chris. That's so cute.
Whenever I go to conferences, you know, we used to bring back.
Sure, the one I like is the Hold My Beer State. I guess for the Hold My Beer State.
Well, I would just, Terry, I don't know if you or Peggy want to go out and get Angie and just say, come on, we'll just get started. I don't know.
Hold My Beer.
Thank you.
How cute.
Well, what if he comes and?
You can bird dog us down.
Is she coming for the meeting?
Yeah, she is.
Yeah, but she will stay out there for a little bit.
Everybody at this table, you
Love her.
I guess somebody could call her.
Huh?
Does she have her phone? Could somebody call her
I don't.
when it's her turn to talk, or?
Cause she's not till later, right?
Yeah, we just, because we don't have to keep it open per se. She wanted to give her vital statistics report.
That's not till the end.
You know, as you know, everything
Yeah,
changes.
we can call her.
We have to do.
Right.
I have a feeling David George isn't coming, because
What
He would be here by now.
that was strange, we couldn't reach him, and I don't have any idea if there was something personal going on. or-
Do you want to actually do a roll call just because we're
Yeah,
on?
yes, I think it'd be a good idea.
Just do a roll call.
You want me to do it? I will.
Yeah, that's
Okay.
Maybe he's here.
But I mean, like, you don't notify all the families that, or do they, like ones that are on there?
Oh, yeah, Dave is here.
Grab your folder and you're here.
We're streaming live here, sir.
Hello.
Yeah.
Good.
Just you.
Now, I guess the mask is fine, so he says peel that off if you don't like it.
Adorable.
Very sugary, kind of.
They're just adorable.
Okay, we ready to get started?
I am.
Okay. Good afternoon, everyone. Oh, sorry, go ahead and hit the A button if you wouldn't mind. Go out to the world.
And this is on broadcast on,
This is on Spectrum, Facebook, and the city's website streaming, so. It's the way we have to do it for the public meetings, for the access to the public during, when we can't have people in the
Spectrum has a channel
Yes.
specific for this?
1024. So good afternoon. Welcome to the April 15th, 2020 meeting of the Board of Health. I know this is a little bit unorthodox for all of us, so we appreciate you all getting together so we could go over everything that is currently going on in the world and here in the city of Ashtabula. I'm going to go ahead and call the meeting to order. Chris, if you wouldn't mind taking a roll call, please.
Absolutely. I'm going to call for the members present. James Timonier, President.
Here.
David DeGeorge, President Pro Tem.
Here.
Maria Fowler.
Here.
Terrence Guerrero.
Here.
Christine Seifert.
Present.
Ruth Simon.
Here.
And let the record reflect that Ruth is here via FaceTime. She is out west with her family. Our bylaws do allow for electronic presence at a meeting for particular situations, and this is one of them. My staff present, if you all could sign in. I'm Christine Hill. I'm the Health Commissioner for the Ashtabula City Health Department. Terry Collette, Environmental Health Director.
Here.
Peggy Ducro, Director of Nursing.
Here.
Colleen Jones, Director of Nursing.
Here.
And let the record reflect that Mary Angeli Montalvo, who is our Registrar and Vital Statistics person, is also going to attend the meeting. She has just stepped out for a moment. And then our Medical Director, Dr. Bishop. I'm here. So we do have a roll.
Okay, great. Just a reminder to everybody, I know it's, again, unusual for us, but make sure your mics are down and you're talking into them so we can all hear and have this recorded. We do have a quorum, so first off, I will entertain a motion to waive the reading and accept the minutes of our previous Board of Health meeting.
Before there's a motion made, I did want to inject something. We caught a mistake in the meeting minutes, one minor thing, and I wanted to add this before you approved it. We forgot to list the guests that were at our meeting, at the last meeting. Solicitor Michael Franklin was at our last meeting, and Stacy Sinitsky, who is the council clerk, was also at our meeting. So we caught that, and we will make that correction. Other than that, I had no other corrections that I needed to make.
Okay, I'll entertain a motion to accept those minutes with the noted corrections.
So moved. I'll second.
We have a motion and a virtual second. Any further discussion? All in favor?
Aye.
Any opposed? Okay, that motion carries, and the minutes stand with the corrections. We'll go into the environmental health report. Terry?
Okay, the environmental health report for March is on page 2. At the beginning of March, it was regular business up until the 15th or 13th when we started with the COVID-19 concerns and closing of, first started with the salad bars, closings of salad bars, and then the bars and restaurants. And then as you can see down on the list, numerous conference calls and staff meetings and other functions that we needed to close, mass gatherings, bowling alleys, YMCA, and all the way down to the end of the month. Also noted on the sheet was number of calls. Phone calls consisted of people calling in with concerns about their business being non-essential and just general questions with COVID-19. And then the nuisance log is at the end of that page, goes up to the 13th when we were still able to go out and do inspections. Any questions on the first page there?
Okay.
No? And then the next page is information that was sent out to the operators, the amended stay-at-home order that was signed on April 2nd that directed all stores to post a maximum capacity for their store, limit the distance in, as people were standing in line, to 6 feet apart, and cleaning the baskets and carts. Those were all emailed to our RFE stores in town. Then the next page after that is a letter that was sent out on April 10th to our marina operators to address a COVID-19 plan that we're asking them to look over and adopt a plan for each their specific marina, designate areas that should be closed, common areas such as clubhouses, restrict people in areas such as bathrooms, implement signage, and address out-of-state membership, as the order currently addresses out-of-state people coming to Ohio. Are there any questions on those?
I don't have a question so much as a comment. I really want to thank Terry for her very long days and long hours of work. I don't think that this in black and white shows you the amount of stress and diligence and work that Terry has put into this. You have to imagine that these orders and these things that the health department has been asked to enforce have been changing daily, if not hourly. And, it is our job to get that information out to our operators, and Terry has always been a very good communicator, and her strengths and her skills as a communicator have come forward. She is a very patient person and just very detail-oriented, and I appreciate her good minutes and her good record keeping. She has worked a long hours and many days, and I just wanted to acknowledge that. I also wanted to add that the order that she sent out, the amended director's stay-at-home order that talked about the enforcement of maximum capacity of persons allowed into a business, she not only sent those over to her food services, but also through the chamber, they were sent out to a variety of businesses that are still open and that are essential. So that the businesses, if we're having trouble keeping up with this order, I assume everyone else is too. So we're trying very, very hard to communicate everything out as best we can. And, like I say, I do commend Terry for her hard work. And the marina situation, that also doesn't translate in just this letter. This was a lot of meeting, and I thank Jim Timonier also for his leadership, because the marina program is a program we have unique, to Ashtabula, because we have a lot of marinas. And, working with our state partners, working with our regional partners, working with the city, a decision was made to allow the marinas to open, much like they're allowing golf courses and some other places to remain open, but the public safety is of our utmost, concern. And we decided to model our marina reaction sort of after some of the things that were done throughout the state, and actually asking the marina owners to come up with a COVID-19 plan. Tell us how you're going to keep your marinas open and can keep your people safe. How are you going to accomplish that? And then in our letter, we included the bullet points of the main things that we wanted to see in their COVID plan. They can customize their plan, but we absolutely have to see these bullet points that talk about the social distancing, that only members are allowed, that common areas need to be closed, like the clubhouses, and that the law does allow some areas to be open, like restrooms and laundry facilities, but they have to control the people coming in and the people going out of those areas. They need to show us a cleaning plan, how they're going to keep those areas clean. We personally had phone calls, Terry and I, with each and every marina owner to talk them through this email that was coming to them about the plans. And I have to commend the marina owners. They were all pretty well prepared for that phone call and ready to talk about what they wanted to do to keep their members safe and keep their marinas open. So, and that's just one example of one business that we've dealt with. All of our businesses, we've had many complaints and things that we've had to investigate. And people have been just so cooperative, Terry. I don't know if you want to
Thank
talk a
you.
little bit more about that, but,
No, I think you said it all, Chris.
you know, she's gone out, you know, we might get a complaint that, well, they're not having social distancing in this factory or this business. And, you know, we go, we check, we talk to them, and we found probably 95% of the complaints to be not true, and that there are COVID plans in place and people are. But day by day, different things pop up, and we have to be reactive to it.
Oh, like the one that we went on yesterday.
Yes, so you
Oh.
can give that as an example. So now that, you know, weeks have gone by and groceries are getting tight, people's have run out of their savings, and they're needing groceries. So we see more and more food distributing popping up, and
Yeah, that down the street, there was a food distribution going on, and we were able to just catch the guys before they pulled away and talk to them about social distancing the people as they were coming in to get their food pickup. And they were wearing masks while they were handing out the food for the residents, so that was good.
and we don't leave any stone unturned. I mean, we had we got a tip about a mass gathering and that food distribution through a picture that was text to me. And we were able to then fact check, hunt it down, find the people, and address it. And, you know, we need that food distribution. We just need it to happen in a safe, responsible manner. And like I say, we have not run into any resistance. I think people really understand and respect that, so.
Yes, they do. Thank you.
Okay, any other questions on the environmental health report? I'll entertain a motion to accept.
Second?
We have a motion and a second. Any further discussion? All in favor?
Aye.
Any opposed? Motion carried. Okay.
Thank you.
Next is thank you, Terry. The next is the nursing director report.
You should have our report in your folders. As Terry mentioned, at the beginning of the month, we were running normal operations, so we did have some immunizations, some clinics. We did our hepatitis A outreach at Karma Kitchen, but then when the building closed down, it kind of limited what we could do. We are available by appointment for immunizations. Obviously, children need their well shots, so that's something that we're working with a family right now to figure out the safest way to get them in the building, out of the building. If it's easier for us to do a home visit, we would have proper PPE, all those types of things. Most of our clinics, the senior center's closed, so we won't be going there. The Towers Clinic we won't be doing. The state has put a halt on the BCMH home visits, so that will be on hold until we get other orders from the state. Traditional communicable disease still gets reported, so you can see that, you know, our STDs are still reported. Animals are sent for rabies. The COVID numbers, again, are reflective of March numbers, so our number is higher than 10 currently. And we still were able to see some head lice kids at the beginning of the basically, our meetings are consisting of conference calls with ODH, the other two health departments in the area. That's pretty much our day is conference calls.
I wanted to say that Peggy and Colleen and we want to give a COVID-19 update to you. The nursing division and myself, we've worked, you know, very, very, very closely together. But we wanted to just give the regular reports first, and thought then at the very end we would give you the COVID update. So if that's okay by you, that's what we thought we would do. So I think that's the end of her regular report.
Yes.
Any questions?
I do. How are we holding out as far as the personal protective equipment? Do we have enough supplies to get through this?
We have supplies for staff for our
Yeah.
department, and we're getting shipments from the state that come funneled through the county health department and then to us, and then we allocate them to the different nursing homes, hospitals, physicians' offices, home care, who put in requests.
So that's a new thing, correct?
Correct, that is not normally one of our regular duties.
I thought that it probably was, so thank you very much for coordinating the efforts.
Sure.
Well, and I have to pipe in here too, just like I said with the environmental health division, these nurses have worked long hours, weekends, you know, when I call them, I get a phone call right back. They're right here by my side. They've been wonderful. You know, the health department has been tasked with many things. The orders that need to be enforced by the Environmental Health Division, and the complaints and the education that goes along with that. That's one thing. Nursing Division is tasked with disease investigation, which we do every day, but this is COVID disease investigation. And what that involves is when we get a positive case from the city of Ashtabula, then phone calls need to be made. We need to investigate their close contacts. And a close contact is someone who has been in less than 6 foot distance for a prolonged period of time. So, you know, we do a lot of interviewing, a lot of fact checking, lots and lots of phone calls and work. And we finally then, from a positive case, have a list of contacts that we then put in quarantine. So the positive case gets put in isolation, their contacts get put in quarantine for 14 days in general. I think that the nurses will explain a little bit more about that. And then every day, the nursing division calls those patients to check in on them, because we're basically clinically managing them at home. We do not want them to go to the hospital. We want to manage them at home. And sometimes that requires running errands or making an extra, you know, extra well visit for them, or getting them a phone number for mental health to talk with them because they're anxious or depressed and, you know, really feel lost. And, you know, we are, even though we're not physically at their home, we're there. And these nurses have been wonderful. And so that is one part of what they've been tasked to do. And then the other part is what Terry and Chris have been talking about, which is the personal protective equipment. And, you know, that has been a real big lift. PPE, that's the acronym for it, personal protective equipment. In this case, it's a 4-part PPE when you're in contact with a positive COVID case. It is a goggles or a face shield, it's a mask, it's a gown, it's gloves. In other cases, when it's not a positive case, we may just have a surgical mask required. We may have an N95. There's a variety of different PPE requirements. PPE, as you know, it's been in the news, has been a shortage of it, and we have worked very hard to be equitable in our distribution of PPE. We have worked very hard to educate about, what do I want to say, about the conservation of PPE. We do not want PPE to be wasted. We've done a lot of education about, let's be smart about who's going in the room. Let's be smart about how often you go in the room. Let's review with staff how to put the PPE on, which is called donning, and taking the PPE off correctly, which is called doffing. And there's videos. Let's show a video, let's practice so that you don't waste PPE and it's put on properly, because you know, if it's not put on and taken off properly, it hasn't served its purpose. So these nurses have worked tirelessly on these projects, and I just can't thank them enough. But thank you for the question about PPE, and this is ongoing. I mean, now masks are being re-sterilized at places like Battelle, and what's the other one? Steris. So we're having good luck with that. We're also, I think, in-house. ACMC, some of the other hospitals they're redoing their masks in-house. So, you know, those are conservation techniques that are working well. And until the supply chain picks back up, we have to be very smart about PPE and how we're using it and how we're distributing it. So.
And I'd like to thank Mrs. Hill also. Colleen and I are both very fortunate that she's a nurse, because she's helping carry the load of all this disease investigation and issuing the orders. So not only is she helping us, she's helping Terry, she's helping with vitals. So I don't think she's had a day off since March. So we're
Can I
very
ask,
fortunate that she's so helpful.
How difficult is it for the nurses to do the contact tracing? Because I mean, sometimes it's very difficult to find good phone numbers and then get calls back. No one, you know, has that been a challenge for you?
It has for some situations. Yeah, we have had some patients that don't have a primary residence, so they're having to reach out to family so that they can stay with one person, so that we can reach out to them daily to do their monitoring. We have some other people that have no family, no friends, so they, you know, are a little more dependent on us to do their check-in, to, do some of those things. And like you said, getting bad phone numbers. We had a person who has no phone number, so his only contact was through social media. So we're getting pretty creative.
The nurses have been creative. We've used Facebook and social media, and, we had one contact that we, initially we had a phone, and then the person ran out of minutes. So then through the girlfriend, we were able, you just have to just try not to give up. Usually we can check in, but it hasn't been easy.
It's been creative, yes. Any other questions?
Anything else for the nursing director? Take a motion to approve the report.
So moved?
Got a motion and a second. Any further discussion? All in favor?
Aye.
Any opposed? Motion carried. All right, we will have the health commissioner's report. Chris?
Okay. Under accreditation update, I know that Peggy and I typically do that report for you. Our last Board of Health meeting, I let you know that the Public Health Accreditation Board officially put our accreditation efforts on for the whole state of Ohio, who is mandated to become accredited health departments. They put the whole process, doesn't matter where you are in the process, they put it on a 90-day hold. We got an official notice from the Ohio Department of Health, I think it was a couple days after we had your last Board of Health meeting, that Ohio Department of Health supports that decision. So just stay tuned. I mean, it's hard to even think about accreditation activities when, we're in the midst of this COVID response. So, but, I'm awfully glad we got, we were at the point of waiting for a site visit. And I'm glad we're at that point because, I can't even imagine trying to put it together from the beginning with all this COVID response. So, but that's probably the most recent. I don't know, is there anything else, Peggy? That's probably.
No, yeah, everything's just basically on hold
Until we
they
hear.
don't want to come see us either.
And then before you is the financial report. There, you can take a look and let me know. The expense report is before you. There's not anything out of the ordinary as far as expenses. We had some insurance billing fees that we see regularly from Mitchell and McCormick. We have been going through a lot of postal stamps because you can imagine we have to mail out all these orders of isolation, quarantine, lots of educational material going out through the mail system. So you'll see some postal expenses and some envelopes and some labels, all related to, getting information out. And the 204, which is the food service account, again, nothing out of the ordinary. There was a maintenance agreement for our Xerox equipment and fuel costs for the car, for her to go out into the field, for Terry to go out into the field. So the only other thing I wanted to add to our financial report, the city has been wonderful about, basically Jim said, look, the city is going to be in some financial crisis here, but we have to take care of our residents. And as far as I'm concerned, we will find a way to pay for what you need at the health department. And I do appreciate that support. I really do. It's allowed us to come in on weekends as we've needed to and stay over into the evenings when we're deep into a contact investigation, and we haven't been, not given the resources that we need. Let me put it to you that way. We do expect to see some funding, and some funding has come in. We got a $5,000 payment from the Ohio Department of Health, which I told you last board meeting, I signed an agreement with the Ohio Department of Health to receive. It's just some straight out funding from the state, and we do have that. Because there are going to be, besides the man hours and so on that's happening, we're going to be depleting our supply of PPE, and that's why we keep a supply of PPE. That will need to be replenished. So, keeping all those expenses in mind. We also, this week, got some stimulus payment from the CARES Act, and that was $6,405.67. Some of that is for the fire department's activities, there's a formula, and I won't bore you with the statistics unless you want to talk to me afterwards, but the fire department got a portion of that, and the health department got a portion of that payment. So, and upstairs, the finance division, I mean, my hat's tipped to them. They are right on it, coding everything for COVID. They're keeping very, very good records about our time spent here, what's been spent for COVID. We keep very detailed logs of why we're here overtime, what we're doing. I think it will all benefit us in the end when we go to balance these books and say what was happened and how we paid for it. So I did want to let you know about that, a little bit of income coming in, so. And I don't know, Jim, if you want to say anything more about budget. I know it's not.
Yeah, so we did apply for, when we declared the state of emergency, we did file both as a health department and as the city for FEMA funds. How those will be distributed, what they will actually pay for, it's still kind of uncertain. They just basically said, you know, hurry up and get your forms in. So we did that. Not only here, but most of the county did that, and most of the agencies throughout the county did that as well. The biggest thing that we are, as far as an overall city budget, the CARES Act did address some municipalities. All those municipalities over 500,000 people, which means in the state of Ohio, Columbus is the only one that gets any funds towards it. We have been on the phone with senators, congressmen, both in the federal level and here in Ohio, telling them, you know, our woes and our concerns with all this. Obviously for us, it comes down to income tax and it comes down to property tax. Despite what's been reported, it was more than just a brief phone call with the governor that made us all trigger and go running to our budgets and see what we needed to cut. I have statistics that show at the beginning of March, at the end of the week, March 14th, there was roughly 740 continued cases of unemployment. As of April 4th, we were over 5,000 just in the county. So economically, obviously, as you drive around, you can see the businesses that are closed. You can see some of the manufacturers that had to do layoffs. Even in our healthcare system, there's been layoffs. While so many different things, especially in the elective surgeries and things like that haven't taken place. So some of those people are not at work, and there's little for them to do, and the hospitals aren't receiving that revenue as well. So our concern comes down to income tax and what's going to happen with property tax. Most of you saw that we did push back the income tax, receiving income tax till July 15th, like the rest of the state did and the federal government did. So now it's a cash flow issue, trying to get out to that point. So we're projecting, you know, if we do a 20% decrease, that doesn't mean that we've lost 20% right now. That means we're projecting over the rest of the year that our income's going to be down 20%. You know, we're not going to flip a switch and everything's going to be back to normal. I'm hearing from some businesses that I'm calling, they're very, very unsure if they're going to be able to open back up after all this. We know there's going to be a hesitation in the public to get out into mass gatherings and, you know, head out to restaurants with large gatherings, or the reverse raffles or anything like that go on. So it's going to take a while to get back to, you know, quote unquote normal, whatever that new normal is. So that is kind of what we're projecting is around a 20%. I'm running different models of that, anywhere between 10 and 20%. And the finance department has again been wonderful on that. As Ms. Hill stated, we are doing what we can to keep our employees safe. So we have divided shifts. You see our sanitation department out there from 6 in the morning till 10 at night to keep them safe. We're doing rotating schedules here at City Hall, just to keep different shifts apart from each other. That way, if one shift gets infected, we still have another shift to fall back on. So we're spending a lot of money keeping people employed while still trying to maintain the continuity of service and the continuity of our departments, which so far is going well, but we really absolutely need the state and the feds to step up here and provide some of those funds to us. We know we're not going to get what we're going to realize in lost income, so we will have to make some cuts to our budget, and we're going to have to act fast on that. So we're putting some plans in place right now to see what those look like, having discussions with our unions and everything which they have been tremendous, offering a lot of help and suggestions on their own. They all know what's at stake here. So I'm glad they do. I'm glad there are people that do realize what we're going through. As you saw in the paper today, the county has made some significant cuts. I'm sure even in the schools and everything else, we're looking at cuts. So we're hopeful if anybody out there in Facebook land or TV land or can call your senators and representatives, please do, because this does affect us at the municipal level as well in the services that we can provide.
Mr. City Manager.
Yes.
Is the sanitation, is the transfer station still open? Can people dump trash?
No, unfortunately, we have had to close that down because of splitting up the staffs, and we have done some things to try to make that safer down there, that if we do open the hole back up, the transfer station back up, that our employees taking the funds and having people coming in and out will be safer. We were shooting to do that by the end of this week. I'm not sure if we're going to be able to pull it off. We have some illness going through the sanitation department right now. So we're monitoring that, and once we're able to have a staff member there, we will open it back up, but on limited hours. But we've installed some shields and different things like that to separate the public, to separate people and keep the social distancing. And the guys do want to open back up down there. That alone, we're probably losing $2,000 to $3,000 a day by not having that open. So those are some of the operations that have been affected by this.
Thank you.
Okay,
Okay.
thank you so much for speaking on that. That is the end of my regular report, if you guys would like to approve that.
Yes, we'll go ahead and approve the financials and the health commissioner's report.
So moved.
Motion and a second. Motion by Dave, second by Chris. Any further discussion? All in favor?
Aye.
Any opposed? Motion carried. Okay, you want to get into a COVID
Yeah, we wanted
discussion
to expand a little bit on the COVID, so I don't know if, Peggy, if you want to go to the microphone. I think Terry, I don't know if there's more you want to talk about in EH. I know nursing has a lot more they need to say. So you'll see in your packet, it looks like this. It's a bullet pointed, it says COVID-19 Health Commissioner and Nursing Division Department updates for the Board of Health meeting, so.
So this is our updated numbers from so far today. So we have 13 lab confirmed positive. So that means 13 orders of isolation have been sent out, signed by Commissioner Hill. We have one probable patient who is symptomatic. His physician wanted him tested. We just don't have any way to get him tested. He does not have transportation. He doesn't have family, so we are treating him as a probable case. And you'll see down a couple bullets. Initially, when this started, the state had us tracking what they call PUIs, persons under investigation. So someone that was symptomatic that they thought possibly had it, was waiting for test results, and then so those were considered reported. Then it became so overwhelming because of the numbers of people that were being tested, the delay in getting the results of testing. It was a lot of work, contact tracing, and luckily a lot of those people came back negative, so then they were like, that's a lot of wasted time. So they changed the orders that it was only positive cases that needed to be followed. So we were following those. Then on 4/8, Dr. Acton changed the journal entry saying that now probable cases. So there's some different definitions of a probable case. They have to be symptomatic. They have to have some sort of visit with a physician, some telehealth, some sort of medical intervention where they've been assessed and the physician feels that they probably do have it. We're not going to send them for testing. They're stable. They could be managed at home, and then they're put under isolation and quarantine orders for their contacts. So those are now again being reported. So the state has a disease reporting system that we have to log all of this in, as well as their contacts. The state had a database that we were putting the contact information in. They've now purchased a new software that we now all are getting sign-ons to, where the software has a capability where it can text the contacts to get their symptom management if those people are willing to participate in this program. So the ball is moving at the state level to get this to come through. Colleen and Chris and I have sign-ons when it's available. We'll see if it's something that our contacts are willing to participate with, which would then decrease the load on us for doing that daily symptom assessment. So currently, when patients are put under isolation and quarantine, an order gets issued and they're done for 14 days. But the clearance is different. So you have to be a minimum of 7 days isolated in your home, plus 72 hours fever-free without medication and improvement in your symptoms. The symptom profile has also changed. Initially, we were looking for fever, cough, shortness of breath. Now GI symptoms have been added, loss of taste and smell have been added, conjunctivitis has been added in the profile, abdominal pain, just muscle aches. So now, our questions are changing as this is going on too. So we do have a couple patients who have only had GI symptoms, never had a fever, have never had a cough, and they've tested positive. So it helps us with education because we can tell people that just by you staying home, you might not think you have the COVID because you've had, 2 days of diarrhea, you had such and such for dinner the other night and you think it's related to that, but you do have COVID and now you're here in the environment making other people sick because you don't have the typical presenting symptoms. So it is helping for an education piece to kind of stress that point. Trying to think. Yeah, so as you can see, we had 61 close contacts of those 13 patients that we're following and doing their tracing. The exposure management guidelines. So when I talked about the 14 days, initially that was pretty much set in stone, and they've kind of relaxed a little bit on what the release criteria is, partly due to healthcare workers. Like Cuyahoga County reported that 33% of their positive cases are healthcare workers. They need those healthcare workers to report to duty if they're close contact and they're not symptomatic. So CDC and ODH has taken these amended orders where if you're contact of someone who's tested positive, you are under quarantine for those 14 days, but you can report to work if you are symptom-free and you wear a mask. And when we say symptom-free, you have to be evaluated by a supervisor. It can't be self-reporting. I feel okay, I'm going to work. So your supervisor, essentially OC Health, somebody's got to temp you, make sure you don't have any of those symptoms, and you can go to work. They just also now,
I'm sorry to interrupt. What is the difference between isolation and quarantine?
isolation is symptomatic. You're ill. You're sick from the germ. Quarantine is you've had an exposure to somebody that you know has the germ, so your possibility of getting sick from that. So we're going to watch you for 14 days in hopes that you don't get sick because you've had that exposure. If you develop symptoms during that 14 days, depending on who you are and what the testing requirements and availability are, you might then go get tested, come back positive, and then now that puts the rest of your house on an extended quarantine because they've still had exposure to you. So we're seeing that as well in some families that we're following.
I think it's a bullet point on your paper, another thing that changed, it was a real game changer. When we first started contact tracing, we were interviewing, the positive cases, talking about who they might have had close and prolonged contact for the 14 days prior to the symptom onset. That's a long time to remember back. And they did reduce that now to a 2-day look back. So that has changed and made our contact tracing a lot easier in some ways. And
As well as the stay-at-home order. I mean, majority of people, unless they're essential workers or critical infrastructure workers is how they're naming it now, most people should be staying home. So their contacts should be less than they were weeks ago for us, where these people were going to work and they came in contact with 22 people, in one day. That was very
our
overwhelming.
initial cases, the contact list was much longer.
Yeah.
So, and people didn't have the social distancing orders, and so that has lightened the load a great deal. And the other thing, I know we say we have 61 close contacts that we're monitoring. Thank goodness we have the stay-at-home order. Thank goodness we have these things in place, because can you imagine what it would be like if we didn't have that in place? And we also have a lot of clusters, family clusters, which you would expect to see. The people that are, the people that are in quarantine that have had an exposure then become ill themselves. They get tested, they're positive. but their connections, their close contacts, are that same cluster that we had already identified. Maybe one or two other people, but for the most part. So, I think another important bullet point on this front page is the number of businesses. I think it's the fourth bullet point down. So these disease investigations have involved greater than 17 businesses and agencies. And that can be a handful. You know, we're talking about, you know, lots of phone calls with some of the larger businesses to, you know, take a deep breath. Let's talk about how we're going to manage this in your business. What kind of notification to the other employees that work there? What does that look like? And the nurses have been really wonderful about, you know, handling the businesses and getting the education out there. And you know, we're also part of a region. We are in a regional FEP grant where we practice for disasters with our lead FEP agency is the Cuyahoga County Board of Health, and they are wonderful. They share lots of documents that they've developed, and you know, it's just really been helpful, especially when you have to deal with a business who is in panic mode because they have a positive employee. And you know, again, that also spills over into environmental health, and Terry going out and dealing with the business about cleaning and cleanliness and how to keep the employees that are coming to work the next day assured and knowing they're coming into a clean building, and you know what they're going to do. So that's the 17 plus businesses have been, you know, a lot of work for the division, and I did want to point that out.
Yeah, and some of it, like Chris mentioned earlier, is fact checking. You know, my girlfriend's brother's cousin works with so-and-so who works at such and such factory, and they're positive, and they, you know, and I need to be tested, and so we're like, okay, let's get a little more information. And then, oh, well, no, that person doesn't even work at this facility, you know, and it's too, when it is someone at a employer, all of the employees are panicked. So we're checking HR and payroll to see who really did work with David DeGeorge on such and such date, because I've got 6 people that tell me that they had close contact with him, and he's telling me he worked with 2 people that day. So it's a lot of fact checking and saying, okay, you know.
And we don't leave a stone unturned, though, because we have found through sometimes listening to a story that might be 80% rumor, there might be 20% of something that we need to look at, you know, really leads to something that we needed to know. And so anybody that calls or any information we get sent to us, we do fully check it out, because we have found it to be, even if it's just educating the person and whatever, but we have found that it has led to some things that, you know, needed corrected. So I've kind of turned to the second page of bullet points. I don't know if you want to go through that. We've been participating on a lot of conference calls, because communication in a crisis is so important. Tuesdays and Thursdays at 11 o'clock, the Ohio Department of Health conducts a local health department and agency and partner phone calls, and this is a touch base with ODH to talk about. They usually talk about the orders that are enacted, and maybe orders that are coming, and their rationale for it, and and then they share. We have a question and answer time about what's happening around Ohio, and we can learn a lot of lessons from other health departments. One of the big things that and Terry, maybe when you get up to the podium, you can talk a little bit about the dispute resolution. So she'll talk a little bit about that. That has come from some of these calls. Monday and Wednesday and Friday, I know Jim's on it with me, Chief Gruber, Chief Stell. It's a Ashtabula County leadership call, where we have, I can't even think who was on the call. It's just county commissioners and all the cities and all the villages and EMS and EMA and hospitals and
Mental
211,
health.
and everybody has a chance to just speak and talk about what has happened in the last couple days, and it's just amazing the information you get from this, and you're getting it firsthand from leaders, and it's very, very helpful. The county commissioners, I think, have organized that, and that's been very helpful. What else?
You'll see the EMA, EMS bullet there, 1, 2, 3, 4, 5 down. Dr. Acton had mentioned on one of the 2:00 press conferences about health departments being allowed to release addresses of known COVID-19 patients and their contacts to EMS to allow for better protection for response. So we, with our other health departments in the county, kind of discussed it to see if we were comfortable giving out. I mean, that's protected health information to a degree. We don't give people's names. So we met with EMA and EMS, and so they basically, EMA wrote a policy, this contagion awareness procedure. And what we do is we report the address of the known positive, and then we put the date, obviously, that we're aware in the lab, and then we tack on a little time because of situations we mentioned where person A is sick, and then 3 or 4 days later, person B in the house is now sick. So that's extended that quarantine time. So we've kind of padded that so that to protect the first responders. I mean, ideally they're wearing PPE as much as they possibly can, but if you know you're going into a home where there's a positive COVID-19, you're going to be a little more careful. Make sure you have all your PPE on.
Right, and I mean, we were very careful approaching this because, you know, in a pandemic like we're facing, you know, we hold patients' records and medical information highly confidential, but there are situations where people need to know. And, you know, again, from the state level, you know, we were told that this is encouraged to the point where I think there's going to be a director's order mandating that we share information with our dispatchers. So we did talk to them at length. We didn't want them to think that this was the end-all and be-all, because that list that we have of isolated patients and contacts changes. It's ever-changing. And there's no way in real time that we could keep that completely up to date. On the other hand, we want to conserve PPE. We want to be smart about how we're using PPE. We want them to approach all calls, you know, with universal precautions, but we want to be smart. So this is that balancing act that we've had to do every day. And this is a brand new procedure. We just started it, I think, on Friday. And so I think it's been working well. So there might be some tweaks to it as we go, but that was a big procedure that we did have to work out.
We also have been working well with, you know, ACMC and UH. We've had some assistance to get some priority testing for first responders. Some of the testing that's done by private labs, there's a delay on the results. It can take up to 7 days. So these private labs are now getting into it. So some doctor's offices, different clinics can use those if they aren't affiliated with UH or Cleveland Clinic. But so then that gives us 5 to 7 days where we're watching somebody wondering, is your test result coming back positive? Are we now tracing your contacts? We're trying to get more information. So both hospital systems have this priority testing. So if it's a first responder, healthcare worker, someone that is symptomatic and you need to know soon what their results are, they're fast-tracked through this. So that's been helpful because we've had to put some people through that process. We've worked with Signature Health and Battelle Labs. Those are 2 of them that are going to be doing the testing, not through the hospital system, so it's private labs. So that's going to be, we had to work with them on how they report. The general reporting for any communicable disease usually goes through the Ohio Department of Health's reporting computer system, but not everybody's hooked up to that. So we made sure that they know how to contact us, how to notify us if one of those comes back positive, and they're going to send us the list of probables of people that have been tested that are suspect, so that we're ready if something comes back positive. PPE, again, has been something that's usually funneled through EMA based on all the plans that we've always worked on, but of course through this pandemic it's being funneled through the Ohio Department of Health and local health departments. So that is something that we are tasked with taking care of, and Angie set up some nice spreadsheets to help us with tracking, and we can make requests to the EMA, but we get what we get, and then we've got to funnel that out to who's made requests to us. So again, we've had things in the past from Ebola, from FEP grants, CRI that we have for residents, for staff here in the city, but the need right now is there, so we're cutting into some of our old supplies to get these people the protection that they need. We do sit reps to the county health department regularly, and Jen Cleveland is the emergency response coordinator. She puts them out to the whole ACFAT group, so that's EMS, schools, hospitals, health departments,
Long-term
mental
care
health.
facilities, mental health.
Yeah, so
It's
that's,
a wide variety of people.
yeah, at the, closer to the bottom, things are changing with long-term care facilities. So if you watch the 2 o'clock press briefings, they've mentioned that long-term care facilities are now required to notify the families of the residents if there's positives within the facility, either an employee or a resident. We've not seen that order come through from Dr. Acton yet. It's just been mentioned in these meetings. So we've reached out to, we have 2 facilities in our jurisdiction, and we've been in contact with them regularly. They've put their PPE requests in. We have filled them. We talk with their ICPs. We've reached out to get what their response plans are. Like, some of them are gonna, if they get a positive patient, they're gonna change the whole wing to be special just for COVID patients, to kind of reduce that risk of cross-contamination in their facility. And they seem to be pretty responsive and aware of what's going on, and report that they're following the proper PPE recommendations and all that kind of stuff.
They've been very good. We've been on the phone with them at least weekly, if not twice a week, just to touch base. They've taken the PPE, donning and doffing videos, reviewed it with their staff, because these are things everybody doesn't normally have to do, and they have verbally told us about their COVID-19 plans. We are asking this week if they could submit those plans to us in writing, so that we could just take a look at them. And we've seen plans from across the state that maybe there's some things that we could share with them that might help them. And there's a lot of long-term care and nursing homes that are just in the heat of the fire right now. And it's heartbreaking. It's just a tough situation for everyone, the employees, the residents, everyone. And we just really want to mitigate that as much as we possibly humanly can. I think that is maybe it from Nursing and Health Commissioner.
I mean, we did get numbers from UH and ACMC on their reporting. So we do have a count from UH that 108 have been tested from March 16th to April 9th, with only 6 coming back positive, so that's good. That's about 18%. ACMC reported today that they've done 746 with 21 positive, so that's about 35%. So, and again, it sounds like a lot are positive, but really only the sickest of the sick are supposed to be getting tested anyway, so I kind of am surprised that the numbers aren't a little higher, but okay.
Thanks, Peggy. Tara, if you want to add some COVID information.
So on my sheet, I kind of went over some things real quick earlier. We could go a little bit more in detail. So it's really started on the 13th of March when the salad bars closed, which that wasn't too bad. And then on Sunday, all the bars and restaurants were closed, and that was the day we all 3 were in, calling all the facilities in town to close all the bars and restaurants for dining and takeout only. And then it's increased to the bowling alleys, the YMCA, fitness centers, and rec centers, and swimming pools on the 16th of the month. And of course, every day, we've been having staff meetings every day to go over, what's going on and what we need to do, and what kind of press release we need to get out, what kind of notice we need to send to our operators. One of our places I have on the 19th, I have licensing there for a new restaurant that wanted to open up, and a Puerto Rican food she was going to have, but with the no restaurants for dining in order, she opted to wait because she didn't want to do takeout food only. She wanted dining in. And so she is not licensed yet, but she's ready to go. So hopefully she'll be able to, go back to the restaurant when the order is lifted. She did a lot of work in there, and it's on Main Avenue, just by Perry Park News is where it's going to be. Hopefully she'll still be able to go through with her restaurant. And then when the governor ordered all, non-essential businesses to close, there were a multitude of calls from employees at those businesses concerned that theirs shouldn't be open, so they're not essential, to determine which ones are essential, and then defend that essential order to the employees, why they have to go to work and how they need to stay clean and sanitize and protect themselves. And then the State Department of Health fielded a lot of calls from other areas about why is this facility open in this county and in that county they're closed. So the State Department of Health made a dispute resolution board for those questions to come to them, and then they would give the final determination. The state, did say that it was up to the local jurisdiction to determine that essential business. And, but with the, all the concerns throughout the state, they made this dispute resolution board. So we have been working with our partners, the County Health Department and Conneaut City Health Department, to see what they are doing for their businesses that are similar to our businesses. Are you closing this business? Are you letting this business open? So that we can be uniform across our county, and that's been working out good. We had the conference call with the state to go over legal issues with those essential businesses and non-essential businesses. So that was very informative. And then also on every Wednesday, we have a joint PIO touch base conference call. I think Chris had mentioned that already in the numerous conference calls that we have almost on a daily basis. So,
Question.
yes, Terry.
How many businesses in the city are closed?
Well, I couldn't give you that number off the top of my head. I don't have that. Because there are businesses that I don't license that are closed. And I didn't, we did not make a running list. We do have lists of businesses, but we didn't tally them up for you.
What,
That actually, I want to say something about that. So when this is all said and done, or when the dust settles at least a little bit, there's definitely, whenever you have a crisis or a situation like we're facing, we're going to make mistakes, and we're going to learn some lessons. And I'll tell you one of the lessons that Terry and I have learned, we of course have beautiful lists for businesses that she licenses, but other businesses that are in this community, we don't necessarily keep a list. And early on, when this essential order came across, we struggled to get a list of businesses and recent phone numbers and emails and contacts. This will be rectified. This was very, very difficult. I do want to remark that the Chamber of Commerce was very helpful to us, but not everybody is a chamber member. We resorted to even driving around town to get names, from buildings. The city tax rolls were helpful to a degree. A lot of things are LLCs, that's not helpful to us. So it is a struggle, and it has been a struggle. And it is to me, a lesson learned from this event. Somebody in the city, I don't know whether it'll be the health department or, another agency or somebody, we need to keep a list, a useful list of, businesses that are operating, because it was tough. And believe me, we used Facebook, we used, we Googled, hair salons, nail places, we don't license them. I don't know them all, so we did a very good job, but I don't know if we you know, if she has that right off the top of her head, but.
And there are also a lot of businesses that, you know, for instance, there are several restaurants that even though they could be open and doing takeout, they've decided to close just because it wasn't either worth it to them or too difficult in the operations to make it financially, you know, respond. I know a couple of them did make a go out of it for a while, but then, you know, it seemed like in those first week or two, everybody was out trying to support them and doing takeout and things like that. But when all the layoffs and everything started coming and we saw the unemployment coming, we saw that, of course, back off too. So
I guess I was just wondering about this essential, non-essential. Do people that call you and say, what is my status, or?
So
We had a lot of that,
we
yeah.
developed a list, you know, and like I said, it took time, we pieced it together, and we made those phone calls. We called businesses and said, tell me what you do, why you feel you're essential. And then we compared that to the director's order. And, you know, the director's order is fairly detailed, not as detailed as I'd like it to be, because I still had to make some decisions locally. And this is the dispute resolution council that she's speaking of. Some of those things have, you know, been brought to them, not from our decisions, but throughout the state. You might have, for instance, a dog groomer that one health department said, well, yes, you're grooming from your home and you're only taking one dog at a time, you can stay open. Or another health department said, no, people's grooming can't be open, dogs grooming it's not essential. And so that, I think that was exact one that was taken to the dispute resolution, and they were deemed not essential, must be closed. So you're gonna see that, and they do, as they see these come, I think they have 10 cases before them right now that they're discussing, and they let us know the results of that. So this is an ongoing, ever-changing, you know, process. And like Jim said, we had some initially that wanted to stay open that then decided to close, and I think we had some that initially could have stayed open, weren't sure what they were gonna do, and now have reopened, and they're allowed to be open. So,
Are those disputes being used as like now a precedent's been set? For example, if this county said, you know what, you're a dog groomer, only one dog coming in at a time, you're good. And then somebody brought one of those to that board in the state who said, you know what, no, and that's a final answer. So now do they contact you, and now you have to call the dog groomer who you told in the end of March they could stay open? Now, do they have to be closed as a result of that precedent?
yes, Maria, yes. So if a decision is, you know, rendered, that decision affects all of Ohio, but in uniformity and fairness, that's what we're attempting to do here. You know, we're attempting to do that, and we want it's a balancing act. It's spinning these plates, keeping essential businesses open, keeping the economy as open as we can, but yet as safe as we can. But the dispute resolution committee has, you know, will serve its purpose, because there are some of those kind of gray areas where you could make an argument either way. So, you know, and I know early on we don't have any golf courses in the city of Ashtabula, but that was another sticky wicket where, you know, initially they were to be closed, and then they decided, they backed away from that and said that they may be open, because it is kind of a singular sport, if you could show how you're going to keep people safe. And so it's been complicated. And, you know, we had Easter last weekend. You know, religious events are exempt from this, but I have to say that our religious community has been wonderful. They've embraced safety. We haven't had a lot of issues. Even the churches that did want to do some kind of like a park and pray, we sent out, well, I'll let, Angie's gonna get up and talk a little bit about some of the activities she's done in the COVID response, but, you know, information was sent out to those churches, so.
Any other questions? No? Okay,
Thank you.
thank you.
So if we could have Angie, Mary Angeli, we call her Angie. She's coming up. She's our registrar, so she's the head of our vital statistics, and she's also our administrative assistant. So again, I can't tell you, Angie is just, she's on it. She can spin about 5 plates at one time and handle it all, and keeps a positive attitude. She's our go-to girl. She's very, very good on the computer. She's helped us lots, and she wants to report a little bit about what she's been doing to help.
So, first off, for vital statistics, we are still getting a lot of requests due to now they're needing birth certificates for unemployment, a lot of death certificates requests as well, and I'm still working with the funeral directors. Regarding the COVID-19, I am putting out information on the City of Ashtabula website, under the Health Department webpage, and on Facebook. I also have created spreadsheets for PPE for the health commissioner and the nurses. I've worked on a patient and fever symptom log for the patients for the contacts. I've mailed out letters to the churches. We have about 43 churches in the city of Ashtabula alone. And I've been answering a lot of phone calls on a daily with a lot of complaints with essential and non-essential businesses, environmental health division calls, nursing division calls, and just general COVID-19 questions. And a lot of questions regarding COVID-19 questions that do not pertain to our jurisdiction, so I've also been directing them to the correct jurisdiction as well.
Like I say, Angie's been wonderful, because these people, it's an emotional issue, and you know, you have to patiently sit and listen, and even though you know it's probably not the situation that is in your jurisdiction, she's very patient with people, getting people headed to the right direction where they need to, you know, direct their complaints. We do every morning have a staff meeting, and we basically form an incident action plan. What are our priorities today? What phone calls do we have to be on? Who's going to be on what phone call? What is the nursing division doing? What is Vitals doing? And what is EH doing? And how can we support each other? And that's how we do it. Take it a 24-hour chunk at a time and peel that onion back, and it's worked well for us. Sometimes we have to huddle in the middle of the day and figure out a new plan, but it's working. So I just really want to thank Angie for all her work too.
And that's it for me.
Thank you.
Thank you, Angie. We did accept your report, right?
Yes.
Okay.
So really, we're just discussion.
Any other discussion from the members of the board? Any other questions?
I do also want to thank Dr. Bishop. She's been there for me too. I had a couple, you know, I am a nurse, not a doctor, and sometimes I need to talk to her, and I know she is so busy in the middle of this pandemic, but she will phone me right back very quickly, and she's always calm and reassuring, and I just want to thank her. It's so nice to have you on our team. Appreciate it.
Anything else from the board? I would just close, obviously, working in the building with Chris and the rest of the members of the health department staff, when this thing kind of all kicked off, it was absolutely amazing to watch how well they all work together, how quickly they have responded to everything, how open to my questions and trying to understand everything and what it meant for the city and all the things that we had to do here. And I'm very grateful that they have allowed me to sit in on some of their meetings and on the ODH calls to get as much information as I can to make some of the decisions that we've had to make, and of course to be there to support this team. As you can see, it's a very small department, and to cover 19,000 people and all these businesses and tourists coming in and everything that we were anticipating for this summer, making these tough decisions in the interest of our community health, and just to see the response that they have done, and the contact tracing and the calls, and the information that they've gotten out and what they understand and know, and how quickly everything came together. Very, very proud that they are our health department. As you know, there's only 3 in the county. There's the counties, Conneaut City has one, and we have one. So these folks are covering a large territory. It has been awesome to see a lot of different agencies in the area leaning on our local health department for information. And again, that's a testament to how well this staff works together and under your leadership, Chris. So I very much appreciate everything you guys have done, and the long hours that we've been here on the weekends, and how do we get into the building, and how do we set up a meeting like this where we can't have the public? So, again, I commend you, and I know everybody is tired, and hopefully we're getting to the point where we can start coming out of this. I still think we have a little way to go, but all in all, everybody is in very good hands with this health department, and I'm very happy that you're on our team. So again, thank you for that. Just one little bit of last note, Chris Seifert brought us all cookies today from the bakery on Main. We're gonna have a new bakery shop open up on Main Avenue soon. And I feel bad for Stacy Stevenson. We were working with her before this all happened to get her opened up. She's gonna be on the southeast corner of West 46th Street and Main Avenue. We're really looking forward to her being here. So a bit of good news as something to look forward to when we open things back up here. If we don't have anything else from the board,
I'm sure next board meeting, we'll be talking to you a little bit more about, you know, re-entry, like our exit plan. What's that look like? How's that gonna be? And I'm sure by that time that those plans will be up and moving. And, you know, we're in this is a marathon for the health department because this is just the response to the first wave. There will be more waves. I don't know how many more. And there will be vaccine probably to be administered and continuing education. More testing is coming, antibody testing, more regular testing. So, you know, it is a marathon, and I do appreciate all your support while we stay, you know, energetic and healthy.
lots of caffeine. Again, thank you all for coming. Appreciate it. We'll probably most likely be in the same setting next month for our meeting. So hearing no other information, we will stand adjourned. Thanks again.
Do you guys make a motion to adjourn usually?
Bye, Ruth.
Okay, we just.
Bye, Ruth.
Hi, Ruth.
Hi, Ruth.
Thanks,
Thank you, Ruth. Take care.
Okay, thanks, bye-bye.
Out there in Colorado.
Just push B. Yep.
Should have thanked our camera person.
Is that in your job description over there?
It is now.
I said, Colleen, can you run the camera? She goes, I think so.